The hours after a child's birth are precious, exciting, fun, and at times overwhelming. Parents have important knowledge, experiences, and instincts that prepare them for parenthood. However, new mothers and fathers often have questions about their baby and the care of their newborn. Jan Tedder, a family nurse practitioner and lactation consultant, has provided care to young families for decades. Because she believes that a baby can be a parent's best teacher, she works to help parents understand newborn behavior and babies' special ways of communicating. Though newborns can't say what they want, you can learn how to tune into your baby's body language. Watching this video will help you and your family better understand your baby's behavior, help you feel closer to your baby, and help you take better care of your baby in the months ahead. Most parents have 3 important questions about their baby. How do I help my baby eat and sleep well? How do I calm my baby? And how do I play with my newborn so that he or she can learn and grow? 2 skills will help you take care of your baby. The first parent skill is learning what zone your baby is in, how awake, or how fussy, or how sleepy the baby is. Babies have 3 zones. They have their resting zone, which is their sleeping zone. They have their ready zone when the baby is ready to eat or ready to play. And babies have their rebooting zone, which is their fussing or crying zone, when parents' help is especially needed. The word rebooting reminds us of our computer. Sometimes a computer can be processing so much information at once that it will reboot. And a baby sometimes takes in so much information, either from the outside world or from inside her body, that she becomes overwhelmed with too much stimulation. The second parent skill is recognizing when your baby sends out an SOS. SOS stands for Sign of Overstimulation. All newborns are at times overstimulated as they adjust to being out in the world. Babies born early SOS more often. The first way babies send out an SOS is with changes in their body's skin color, movement, and breathing. This baby, who was born a few weeks early, shows these body SOSs. See how his face turns a bit red in color? His muscles jerk and shake, and his breathing gets faster. The second way babies send out an SOS is with changes in their behavior, spacing out, switching off, and shutting down. This baby demonstrates the first behavioral SOS, spacing out. Watch as Jan plays with the baby by shaking a rattle. The baby begins to look like she is staring into space. Spacing out is a sign of overstimulation. This baby demonstrates the second behavioral SOS, switching off, described in the medical literature as gaze aversion. The harder the mother tries to get the baby's attention, the more the baby looks the other way. This switching off is a sign that the baby is trying to manage the amount of stimulation she takes in. Mothers are relieved to learn what this behavior means, and that it is not a sign that the baby is rejecting her. This baby demonstrates the third behavioral SOS, shutting down. Again, we see Jan playing with a baby. Though the baby is momentarily engaged with this play, she soon begins to get drowsy and shuts down as a response to too much stimulation. When you notice your baby having an SOS, you wonder how to help. You can respond to an SOS by decreasing stimulation and increasing support of your baby. Decrease stimulation by speaking quietly to the overstimulated baby. Increase support by holding your baby's hands against his chest or gently swaying him. Putting your baby skin to skin or breastfeeding him will also decrease that SOS.
This is little Maria, who's now 2 weeks old, but she has a special story because she decided to come into this world 4 weeks early.
Well, of course, because I've had 4 kids, I kind of know what to expect. And in the hospital, she just had little tics where she would jerk or her eyes would roll in the back of her head and she would just fall asleep at the drop of a dime, and we would change her clothes or weigh her even. The startle reflex would just be really too much for her. She would turn beet red and scream, and just it seemed so traumatic. Next thing you explained to me about premature babies being overstimulated and how they can shut down to keep from processing that information so it doesn't overstimulate them. They kind of shut down, and you gave me some information that showed me how to keep her from going to be overstimulated,
And here she is at only 2 weeks old, and she is already way past her birth weight.
So yeah, this is 6 months later. With Miss Tedder's help, we learned how to keep our babies comfortable and how to make sure that we don't overstimulate our babies. And because of that, we have a 6-month-old superstar. When I tell people she's a preemie, they just laugh and say, "Yeah, right." Yeah, that's right.
Oh, you have so much to say. Dad.
As this baby reminds us, breastfeeding is best for the baby, best for the mother, and best for the family. Research confirms that breastfeeding strengthens a baby's immune system, helps prevent childhood illnesses such as respiratory infections and gastroenteritis, and decreases lifelong illnesses such as asthma, obesity, and diabetes in the baby. Listen as this mother describes the benefits of breastfeeding for her baby.
The whole time I was breastfeeding, I never had to worry about, the ear infections and the colds and all of that. It really boosted up their immune system and everything like that. So that's why I chose the...
And she is thriving, and I know we just looked at her growth chart, and she's completely balanced between her height and her weight, which is, of course, we know that breastfeeding really helps to prevent obesity, and I know that's something that's important to you.
Mothers who breastfeed have decreased breast and ovarian cancer, less cardiovascular disease and diabetes. They lose their pregnancy weight more easily and suffer less from postpartum depression. Though babies and mothers benefit from any breastfeeding, exclusive breastfeeding significantly increases all these benefits. Families who breastfeed miss less work, have fewer medical expenses, and save money by not buying formula. Bringing your newborn to the breast within the first hour, avoiding use of a pacifier, and keeping your baby in the room with you will facilitate the bonding experience and promote effective breastfeeding. Avoiding swaddling and keeping your baby skin to skin during the first few days of life, whenever you are awake, are actions that increase breastfeeding hormones, lower stress responses in you and your baby, and help a mother notice when her baby is ready to eat. A newborn has special ways to communicate that she is hungry. She might bring her hand up to her mouth, smack her lips, or wiggle and squirm like this when she is ready to eat. A swaddled baby is less able to show early feeding cues and cries to signal it's time to eat. Because a woman's breasts do not feel different immediately after birth, some women worry that they do not have enough milk. However, the birth of your baby initiates important changes in your hormones and breasts, changes that provide exactly the nourishment your baby needs. On day 1 and 2, mother's first milk, colostrum, contains important body-building proteins and antibodies to fight infection. Since a newborn's stomach is the size of a marble, he eats only about a teaspoon at each feeding. Fortunately, colostrum is very concentrated and perfect for your newborn. Many mothers benefit from a nurse teaching her how to hand express colostrum, especially if the baby is extra sleepy on day 1 of life. As shown here on this breast model, the mother first places her hand in a C shape around the areola and nipple. Next, she pushes breast tissue back toward her chest wall, compresses the breast tissue, and then releases it to express a small amount of colostrum. Hand expression will increase milk production and help if breasts are engorged. Most babies exhibit cluster feeding on day 2. They want to eat more frequently when mother's milk is about to come in. Putting baby frequently to the breast will both calm the newborn and build up the mother's milk supply. By day 3, mother's milk typically comes in and the baby's stomach increases from the size of a marble to the size of a table tennis ball. Now a baby can eat up to 30 milliliters, 1 ounce at a time. Adding water or any formula unless medically necessary can interfere with milk production. Obese mothers, mothers who had diabetes or thyroid disease during pregnancy, or mothers who had a C-section or challenging birth might experience a temporary delay in their milk coming in. A nurse or doctor might suggest supplementing for a day until that happens. To create and maintain a good milk supply and adequate nutrition for the baby, it is necessary to bring a newborn to the breast 8 to 12 times a day. Your newborn's behavior may initially be confusing to you. New parents often wonder whether their baby is going to sleep or is having a shutting down SOS. Look at this baby. Her face is relaxed. There is no tension around her eyes or mouth. Her skin color is uniform. However, the baby on the right is demonstrating the shutting down SOS. He looks like he is squeezing his eyes shut. There seems to be tension around his mouth and eyes, and the color on his forehead is not uniform. This overstimulated baby needs to be comforted skin to skin in order to get back to the ready zone to eat. Many mothers are surprised to learn about a special hormone released in both the baby and the mother as she breastfeeds. This hormone relaxes the mother and can cause newborns to get sleepy while nursing. If your newborn falls asleep after breastfeeding a short while, mother can put the baby skin to skin. In about 10 minutes, this hormone level drops, and your baby will often wake up to complete her meal. You will be reassured to know that breastfeeding is going well when your baby regains her birth weight by 2 weeks of age, when your baby continues to gain 4 to 7 ounces a week, and when your baby has several wet diapers and 3 to 6 stools a day.